So welcome to Exam 2 Review. I really appreciate you all taking the time to come. Hope this helps. Everybody have their study guide out and a pencil or a pen, because I want to add a few things to the study guide as well that you'll have to take notes on. Okay? Nobody's driving, right? Okay. No. Okay. Ellen, good morning.
Morning.
Morning. Did you change the dates on your phone yet?
No, but I know to go back one.
Go back one.
Yes.
That's funny. So everybody put their name in the chat so we can do attendance. I always like to know who goes to live reviews, because I'm telling you, the grades are higher when you attend live reviews. So, okay, who needs to mute with all the background noise? Markel, I think I'm going to mute you, okay?
Oh, okay. I'm sorry. I didn't realize I wasn't muted.
No worries. No worries. Okay, and then come off mute at any time, because this is interactive, right? This is for you. This is not for me. This is for you. Okay, so everybody pull out their study guide, and you're going to take notes on your study guide. Where's my study guide? Okay. So we're just going to go through the study guide, and we're going to be covering these concepts, right? These are the concepts we covered. First group is week 4. Second group is week 5. Third group of concepts is week 6. So I tried to organize it for you. Okay. And then below that is I copy and pasted from the syllabus, all your readings. Okay. And remember, if it's a full chapter, for those of you in my class, what's important at the end of those full chapters? Right? You have key points, right? You have 2 things at the end of full chapters. Well, you have it at the end of every chapter, but if you're asked to be responsible for a full chapter, it has the key points to remember, and then it has some NCLEX questions and case studies. So if you're responsible for a full chapter, I would suggest you go through those 2 at the end of the chapters. If it's just a chapter like here, chapter 11 with just 1 page or 2 pages, you don't need to go through the whole chapter. Okay, I did a review with a student this week, or some tutoring, and like chapter 11, she was going through the whole thing. Okay, no need to. This is all you're responsible for, page 159. Okay, same with common chapter 41, you're responsible for 2 pages. So be careful what you study. You don't have to study the whole chapter 11, the whole chapter 41, the whole chapter 19, the whole chapter 20 at certain pages. Okay. And I wouldn't go through key points and questions and case studies at the end of these chapters, because you're not responsible for the whole chapter, but I would definitely focus on doing those for full chapters. Right. And then don't forget your Canvas teaching sheets, right? There's a lot of information that you're responsible for that's not covered in the book. And so those are on your Canvas teaching sheets. Okay, so in week 4, there's 3 teaching sheets. Where do you find these? Where do you find these?
In the module.
Under your weekly module. So if you go under week 4 module, you'll see there's a teaching sheet on pregnant adolescents, LGBTQ, and mental illness.
Professor Marvel, it's hard. Well, for me, when I read the little lectures from Canvas, it's hard to pick out what could possibly appear on the test.
Okay, that's fair. We're going to go through that. Okay, I definitely, on your study guide, there was no mention of LGBTQ. So we're going to go back to that in week 4 and we're going to review that because there's several questions on the exam about LGBTQ. Okay, so it's not asking you to go back to read the book. It's just asking you to read the Canvas teaching sheet. Make sense?
Yes.
Okay. And again, the same applies for week 5. If you're responsible for the whole chapter, go in and look at that end of each chapter. It's an excellent summary and excellent exercises. Okay. Okay. So, review of the exam, 50 questions, multiple choice, your favorites, select all that apply. Aren't those your favorite questions? No. And then simple math problems, right? You have math resources if you struggle with math, how to set up a problem. What's the formula? Okay, so go back and look at those. 75 minutes, things to remember for an exam. Please, please, please read the question twice. Okay, read it the first time and then read it a second time to see if there's particular words that stick out. What would be important words in a question that would, what are important words in a question?
Priority, prevention.
Priority questions. Yep. Is it the greatest? Is it the least? Which is the best? What is the highest priority? What's the least priority? What's the greatest example? What's the least example? You guys got to pick out those important words because it's going to direct you right to an answer. All the answers might seem correct, but if it's asking you for a priority, which answer is the best answer? Okay. Same with nursing process. Every exam has nursing process on it. Your ADPI, you're expected to be able to translate what ADPI means in the community for each topic. So what does ADPI mean when you're doing an occupational assessment? What does ADPI mean when you're doing an environmental assessment? Okay. And then prevention levels. Be careful in your questions. Pick out, is it asking for primary, secondary, or tertiary? Okay, because those important words will direct you to your correct answer. Right? Okay, let's just go down the study guide with pregnant adolescents. And I have some notes on my study guide that I took as I was preparing for this as well. Okay. First of all, let's just talk about pregnant adolescents as a whole. What concerns you about a pregnant adolescent? Right? What if you're taking care of a pregnant adolescent, what's concerning? I'm just asking out in the open.
Nutrition, how she takes care of her eating habits and wellness.
What about where she lives? Is she homeless? Right? What else is important when you're screening? What about STDs? Okay. So we know that pregnant teens, excuse me, I still have this lingering COVID cough. So I apologize. We know that pregnant teens are more likely to engage in sexual activity without birth control, right? We know that they're very uneducated about reproductive rights and services. Now, this is a general statement. You may have certain teens that don't meet this. Could somebody mute? There's a whole bunch of background noise. Thank you. right? Pregnant teens are present oriented. What does that mean? They don't really think about the future, right? Future consequences, future challenges, future risks, right? They're more likely to get caught up in the poverty cycle, drop out of school, experience domestic violence, abuse, substance abuse, STDs. So if you were based on this, I like to highlight, based on this statement, what would be something that you could educate what would be important to educate if you're working with teens, whether they're pregnant or had the baby? What kinds of things could you assist them, teach them? I mean, the big one for teen pregnancy is we want them to go back to school, right? Education is critical. It's research shows that if a teen can finish her education, it reduces risks associated with her and the baby. Okay. What are some risks during the pregnancy? Preeclampsia. So think about, okay, so let's say we're reading this. Okay. High-risk pregnancies, they're at risk for preeclampsia, low birth weight, premature birth. What might a question be on the exam related to that?
What kind of primary preventions? What could you say that again?
What kind of question? High risk. So if I tell you high-risk pregnancies have an increased risk for preeclampsia, low birth weight, and premature birth, what could I ask you about that?
Who was more at risk for it?
Exactly. Well, yes. Okay, so then, let's ask that question. Who's more at risk for preeclampsia, low birth weight, and premature birth? What's the answer?
Pregnant adolescents.
High risk pregnant adolescents. All right. Or here's another way. What risks come with teen adolescent pregnancies who are considered high risk? Select all that apply. What are your three answers?
Low birth weight, premature, and preeclampsia.
Okay. Okay. Well, how about this? Present oriented. Question. Are adolescent teen pregnant moms past oriented, present oriented, future oriented? What's the answer?
Present.
Yeah. So as you're reading through each of these entries, think about what kind of question. Okay. What's important? Here's something else. What would be important? What certain levels should be monitored in prenatal care for the pregnant teen? What's the answer?
Folic acid, iron, and vitamin C.
Yeah, you're getting it.
Now, do we need to know what foods they're found in? Because they like to ask questions like that.
Nope.
Okay.
Nope. And then each section, I try and give an example of primary, secondary, and tertiary for the topic we're covering, which is pregnant adolescents. So primary, what's primary? What are we trying to do?
Educate them.
Try and prevent something before it happens. In this case, a pregnancy, maybe an unintended pregnancy. So sex education early would be a good primary intervention. What about secondary? Remember, we're trying to find the at-risk teens. Okay. What about a teen who comes to you and says, oh, I can't wait to get pregnant. I have this new boyfriend, can't wait to get pregnant, can't wait. It's just going to be so fun. And yeah. Would you screen her maybe as high risk for maybe needing more teaching or more education? And then tertiary, they're already pregnant. Maybe diet counseling, staying hydrated, eating healthy snacks, bonding with the baby after birth. Okay. So let's say you're visiting a mom, you're visiting a new mom, teen mom after she delivers. What kinds of things are you going to be looking for?
Bonding.
Yep, bonding. What else? Does she understand developmental stages? Does she understand growth and development? What's the child supposed to be doing at a month of age? Does she have a pediatrician? Is this child getting follow-up visits? Right?
Those are all tertiary.
Well, yeah, I guess we consider those tertiary because she's already had the baby. And so now we're wanting to ensure that she's as successful as she can be. Right? And as I mentioned, if you're asked about long-term outcomes of teen pregnancy, what's the most, what is an important part of it, a long-term outcome? I said it at the beginning. What's important? What's most important for these teens? Get them back in school. Okay.
Now, I have a lot of questions for the rest of my. So I was reading something that says anytime you trying to look at long term, I guess maybe that's part of the nursing evaluation, because it said in order, I guess, to evaluate something long term, it says rely heavily on documentation. So I guess that's a different scenario.
No, I'm just focused on if you get a question that says, what provides a teen the best long-term outcome after she's had a baby? If it asks it as a priority question, what's the most important? All the answers might sound good, like bonding with the baby, the baby's a soccer star, whatever, or the kid's grows up to be a soccer star. But what's the most important long-term intervention we can encourage the teen to do?
Education to prevent poverty.
Exactly. Well, education to prevent poverty and lots of other things, right? Because they become at risk for lots of things. At the not only the mom, but the baby too. So that's why I keep hammering home education. Try and get them back into school. Okay, any questions about pregnant adolescents? So I've covered what I need to cover, and that's what you need to know. Simple enough? Okay.
Yes, ma'am.
Mental illness. Who's at risk for mental illness?
Homeless people, substance abuse, victims, whatever. Yep.
Victims of crime. So what question might you get? Or what question could be asked, I should say. Select the population that's most at risk for homelessness.
Or would you say select a population that's
I'm sorry.
for
Yes.
mental illness?
Yes. What populations are most at risk for mental illness? How's that? Thank you. Okay, I'm going to talk more about mental illness, but let's just read what's on the study guide here. Here's some interventions. What would primary be? Maybe we're teaching about coping mechanisms, parental role modeling, right? Mental health services for children experiencing trauma. Excuse me. Stress reduction. Okay, think about kids in schools. I just retired from the schools 20 years. Lots of my teaching with the middle and high school kids, and actually, quite frankly, all the way down to the elementary kids in the last couple of years, right? How do you deal with adversity? How do you handle a problem with a buddy? How do you reduce your stress? Who do you go to talk to if you're not feeling well? All right, those are primary. Secondary, screening for depression, anxiety, screening for suicide, suicidal thoughts. Really, really important if you're working with kids or adults. You need to screen them for potential mental illness. With me in the schools, it was screening for suicide. Because as we know, suicide increased over the last couple of years, right? Okay, and then tertiary, they already have some kind of mental illness, right? So we're trying to provide them support to manage their whatever mental illness they have. That could be counseling. That could be counseling, you know, for families. If it's kids that have the mental illness, counseling for individuals, families. What support do they need? Okay, there's a chapter I want you to review. I really would like, we need to know what kinds of anxiety, maybe mental disorders, okay? I want you to know about OCD. Go back to your chapter. What is it? Let's see, what's the chapter? Chapter 47, care of patients with anxiety, mood, eating disorders. What kinds of anxiety? What's kind of mood? What kind of eating disorders? What's OCD? What's general anxiety disorder? What's a phobia? What's bipolar? You know, maybe the question is asked and given you a scenario. So-and-so has these symptoms. They present to you with these symptoms. What is it? Is this a phobia? Is this a general anxiety disorder? Is this an OCD? Okay. And then what if they're on medication? This chapter talks about some of the key medications some of these patients are on. What do you do for teaching? For example, say lithium. Right? What do you know about lithium? The patient's been prescribed lithium, and the patient is prescribed, let's say, lithium. What do you know about lithium? What are you going to teach? Okay. I'm going to mute people that I think I'm getting background noise from. Okay. Okay, we did the primary, secondary. Okay. Any questions on mental illness? So go to chapter 47, know about the most common anxiety, mood disorders, and a few of the meds. Okay. Be able to identify a scenario. What is it? Is they demonstrating they may be bipolar or have a general anxiety disorder? Okay. I'm trying to direct you to where you need to go. Okay. Substance abuse. We list several things here. Alcoholism, energy drinks, tobacco, e-cigarettes, methamphetamines. Okay. With regards to alcoholism, okay, let's say you're working in a clinic or, I don't know, you're working with clients that are alcoholics. Okay. What would a question be here? Alcoholism associated with vitamin B deficiency, low magnesium, low potassium, iron deficiency anemia. So maybe what risks are associated with alcoholism? Choose one. Well, here's 4. Okay. They're also prone to malnutrition. They may skip meals. And alcohol is considered a depressant. Okay. Please review how we calculate blood alcohol content. What's the formula we use? The amount of drinks you've had over a certain period of time. So be familiar with that, how blood alcohol level is determined. Okay, with e-cigarettes. Here's something that's important right here. The oil in e-cigarettes is poisonous to young children. You got to know that. Okay, and then what about methamphetamines? You know, let's say you're working with a client that has a cocaine or amphetamine or methamphetamine addiction. Okay, so there's a lot of cardiovascular complications that can go with these kind of medications. Do you know what they are? Right, here they are. When do you call 911? Okay, so maybe a question is a client's abusing, let's say, methamphetamines. What might you see? Well, you might see a high body temp, heart rate, high heart rate, blood pressure, high blood pressure that requires emergency attention. Okay. Let's go through the primary, secondary, and tertiary for substance abuse. Primary, trying to prevent something before it happens. Do you have effective coping mechanisms? Do you know how to reduce your stress? Do you know what services are available to you or your kids for any kind of trauma? Do your kids participate in drug education at school or in the community? Are there mentor programs that can try and head off anything before it happens? And then here's a good secondary: screen for dysfunctions in life. We all know who are at risk. Kids, adults are, do we not? What kinds of things, as you screen for substance abuse, what kinds of things would you look for? And how might you screen? That's a question to you guys. What are you screening for? Maybe you're screening for any kind of traumatic event in people's lives. I mean, what causes substance abuse? What are some causes of substance abuse? What?
Anxiety, depression, trauma.
Yep. Yep. So, you know, in the schools, we screened all the time for kids that might be at risk, right? For substance abuse. Are parents substance abusers? Okay. And then tertiary. They're already a substance abuser. Obviously, we're trying to move away from that. But what do they need? Maybe they need a clean needle exchange program, safe injection site, AA, NA, detox, rehab, right? Do we understand why that's tertiary? They already have the issue. So now we try and help them cope, manage, reduce, right? Okay, next topic, death and dying. I'm going to give you guys a question. Well, not an actual question, but I'm going to pose a question to you. You are caring for a death and dying patient. What is the priority nursing intervention that you need to accomplish?
Pain control.
Thank you. Okay. You are caring for a dying patient. What kinds of nursing interventions should you be thinking about? A, pain control. Select all that apply. A, pain control. B, controlling GI or respiratory distress. C, providing comfort. D, guidance and support. I'm just going to keep going. E, therapeutic communication. F, listen for opportunities. Select all that apply. What gets selected?
All.
Everything. Okay, so that's another way to ask a question. Okay, so, and I'm going to put in my 2 cents here about select all that apply questions. Do not be afraid to select all. Okay, don't let your mind play tricks on you by saying, oh, it can't be all. Nope, 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 can't be all. It can be all. If everything looks good to you, it's all. Do not be afraid to do all. Okay, so one of the important things to review about a dying patient is the stages of grief. Okay, if you're working with a family, what's the first stage of what are the stages? What's the first stage? Just going to go through the first one here.
Denial.
Denial. Okay, so if you're working with a family that their family member just died, and you want to talk about when the coroner is going to come in, when the medical examiner is going to come in, what are the funeral arrangements, what, and they don't want to talk about it, is that okay?
Yes.
It's okay. Okay, we need to be able to recognize in the death and dying patient, for the family members, what are the grief stages. So you may be given a scenario of a family that's doing something. Okay, they don't want to talk about it, or they just can't accept it. What stage of grief is this? Okay, so just know a little bit about each stage. Okay. Pain control is obviously the priority, but what are some other things that are extremely important in the death and dying patient? I'll start.
Providing comfort.
Comfort care. Absolutely. How about dignity? And how about
autonomy?
Autonomy. Thank you. Thank you. So those are some other important things we need to consider. Autonomy, comfort care, dignity. Okay. Faith community nurse. What we need to know about faith community nurse. Nursing. What's the difference between religiosity and spirituality? Somebody tell me. Well, I have it highlighted. It's on the second line. Religiosity focuses on a specific religion. I'll use myself, for example. So I go to Catholic church on a Sunday morning, and my congregation is of the faith of Catholicism. So we focus on Catholicism. Somebody else goes to a Methodist church or a Baptist church. That congregation focuses specifically on a religion. That's religiosity. So now what's spirituality? Spirituality looks at the big picture. How do you feel? What do you think of? Do you believe in God? Do you not believe in God? What's your big picture of spirituality? So that's a difference. Religiosity focuses on one particular religion. Spirituality brings your spiritual beliefs into your nursing practice. What's the full spectrum? Okay. What might a primary faith community nurse do? Well, primary, all about education, exercise groups, health education, immunization, stress management. Secondary, what might she do for her congregation or he? Blood pressure screenings, blood glucose checks, again, screening. And then tertiary, kind of the same applies. Support groups for patients with diagnoses. Okay. Next is ethics. And you can go back to your readings and figure out where they like ethics. Where's ethics? Ethics is we're in week 5, chapter 3, ethics. But you only have a couple of pages here, 44 to 46. Don't go read the whole chapter 3. Okay, and remember, when we're talking about death and dying, there's a teaching sheet in your module about hospice and palliative care. Just review that. Okay, ethics. Ethics. So let's say you are working at your job and there's going to be a lot, we're all going to have ethical dilemmas in our nursing practice. They happen all the time. Okay. So what's the first step in solving, so ethical decision making? Are you using the principalism theory? Are you using the utilitarianism theory? I just need you to know that there are certain ethical principles that we abide by. Okay, so if we're trying to assist our organization or a patient with ethical decision making, what's the first thing we need to figure out? Think of nursing process. What's the first thing we have to figure out during our assessment? What's the problem? Right? What's the ethical problem? What's the ethical issue? Okay. The other thing we need to know about ethics is that organizations, hospitals, long-term care facilities, there are ethics committees in these places. What is their role? That's in that, the answer to that is in your book on those few pages. What does an ethics committee focus on? Doesn't focus on everything, it's very specific. So please be aware of that. Okay. With regards to ethics, I'm right here. Ethical duty of a nurse. Really important. Okay. Ethical, provide high quality, unbiased nursing care to every patient you're assigned. What if you can't accomplish this? You can't just walk away. You've got to find another nurse to care for that patient. Let's say your beliefs and values are cultural. You can't do it. You can't just walk away. You got to find somebody else to do it. And then advocacy. What does the word advocacy mean? This is for you guys. I need some answers. What's advocacy?
Just being the patient's voice.
Mm-hmm. We're advocates for patients, clients all the time, whether we're in the hospital, whether we're in a long-term care facility, whether we're in the community, we're always an advocate for our patients. Right? Okay, let's jump to environmental health. What population is most at risk for environmental exposures?
Children.
Children.
Is it the rural areas?
Nope.
What are the,
I mean, people in rural areas are at risk, but what if you get a priority question? Who is the most vulnerable population when it comes to environmental exposures?
Children.
Okay,
Children.
yep, we got that. People without an immune system are most vulnerable. What are they vulnerable to? Infections, right? Think of your clients that may be positive for HIV, have cancer, or an organ recipient. Okay, we need to be very sensitive to those people in the community. They need to be identified. It's like our kids in the schools. You know, if we had kids that were on chemo or kids that had immunocompromised system, we would be calling those parents first. We called it our kind of our rapid response list to let parents know that, you know, the schools had an outbreak of pertussis. Schools had an outbreak of chickenpox. Keep your kids home until this is solved. Okay. Lead is also a big issue, right? We know that lead is can be in buildings that were built before 1978. That's homes, buildings, schools. And can lead exposure potentially cause developmental delays and cognitive deficits in kids? That's a yes or no question.
Yes.
Okay. Lots of risks for kids with lead exposure. And then a couple of definitions. What's toxicology and what's epidemiology? We talked about this in class this week. Toxicology tells you what you've been exposed to, right? So toxicology tests, reports, what have you been exposed to? And then epidemiology, on the other hand, looks at how did this happen? When did it happen? Why did it happen? Okay. Education, jump to education. Okay, patient education is very well represented on this exam. Okay, so where are we going back to look for that information? We're on week 6 because we just did it this week. Chapter 9. Okay, chapter 9 is definitely a good chapter to review. And at the end of chapter 9 are key points to remember, some practice questions, and a couple of case studies. So start chapter 9, please. Okay. Lots to talk about with patient education. Think of the nursing process. Before we can start any kind of education, we obviously have to know what we're teaching. What are the needs? Lots of issues with patient education. What are the barriers? What do they know? What do they don't know? Are they literate? Is there a language barrier? What's the difference between health literacy and health illiteracy? And I don't mean that derogatory when I say health illiteracy. There's a lot of clients that are very health illiterate. Would you agree?
Yes.
Yeah. What are your 3 domains of learning? What are they? We went through that in class this week. Right? Cognitive, affective, and psychomotor. Cognitive is the thinking. We have to incorporate. We all learn in these 3 ways. So we have to consider cognitive, affective, and psychomotor when we're teaching. We all learn it. Some may be more prevalent than others, right? So cognitive thinking, affective feeling. What are your feelings? What are your beliefs? What are your values about what you're being taught? Cognitive, how do you take in the information? How do you use the information? Right? So psychomotor. I'm a psychomotor learner. I like hands-on. I like to touch things. Okay. Okay. Behavioral goals. Okay. So this just goes through the nursing process. Behavioral goals. Behavioral goals are what you intend to change. Does anybody work with people who say, nah, everything's fine. We've been doing it this way for 30 years. No need to change. Anybody work with people like that? Or have family members like that?
Yeah.
Yeah. Behavioral goals are real important with teaching because behavioral goals address actual change. Okay. How do we teach? Calm, unhurried, short sessions. What if we're teaching hearing impaired? What if we're teaching vision impaired? What if we're teaching the aphasic patient? What are some tips on those? You need to know those three. Okay, if you're working with hearing impaired, vision impaired, what are some strategies?
Make sure they have their hearing aid or glasses.
Yep. Yep.
I didn't hear you.
Okay. Ask, are they comprehending things? Do they understand? Maybe start simple. If there's a language barrier, do you need an interpreter? Okay. So education, this little section here on your study guide goes through the nursing process with regards to education. And then what is therapeutic communicate? What's therapeutic communication? Got to know this. Got to know about therapeutic communication. What is it?
A form of communication.
Yeah. Okay.
It could be just sitting silently. It can be I guess asking for feedback or being a listener.
Listener. Yep. Therapeutic communication. How do you let them tell their story? How do you ask open-ended questions? Let them talk. Therapeutic communication is you not pushing your beliefs onto them or your opinions or your judgment. Okay. So know about therapeutic communication. All right. We talked about hearing impaired. I'm just reading my notes. We talked about know some strategies for the hearing impaired, know some strategies for vision impaired, know some strategies, be familiar with some strategies with the aphasic patient. Okay. Okay. Occupational health. What's occupational health? Occupational, if you're a nurse working in occupational health, what is it? What are you doing?
Making sure the workplace is making sure it's, I don't want to say decent, but
Safe.
making it safe. That's the word.
Safe. Occupational nurse has lots of responsibilities. Her goal is to maintain safety in the workplace. She doesn't want injuries. He or she doesn't want injuries, right? So she's got a big job. She's got to do primary, secondary, and tertiary. Okay. Let's say you work in a place that requires a lot of lifting. How do you prevent back injuries? You teach them how to lift correctly, right? She needs to understand the job descriptions of the employer or of the employees. And she needs to try and take preventative action to prevent any injuries or illnesses or accidents. All right. So here, primary, teaching lifting strategies, maybe how to sit at your desk correctly. If you're at a computer all day, how do you prevent yourself from getting carpal tunnel, right? What if you're obese, right? Or what if, that's more tertiary, but diet, lifestyle education, coping mechanisms, stress management, right? If you're working in a plant that's super, super, super noisy, well, before one of the risks is hearing loss. How do you educate the workers to wear their protective gear to prevent any hearing loss? Again, secondary in the workplace, screening for depression, anxiety, screening for obese clients and the potential health risks, screening for substance abuse. And what if you have employees come to you and say, hey, Johnny's not right. I think he's on something. I think he's working with pretty big machines. That's a problem. Okay. And think about all the issues going on with people going to work. Who knows what their story is, right? Do they have a mental illness? Do they have diabetes and they keep missing work, right? Because they don't have money for a glucometer. They don't have money for insulin. Those are the kinds of things that an occupational nurse should be aware of. All right, tertiary, assess lifting strategies. Let's assume they have a back injury. All right, so assess lifting strategies of workers complaining about back pain. Looking at workstations of workers who have developed carpal tunnel. Okay, does that make sense? I mean, technically, everywhere you work, there are risks. Whether you work at a bank, whether you work at McDonald's, whether you work at Amazon, Google, I don't know, I'm just throwing out places. My point is there are risks in every workplace. Okay. Okay, a couple of other things I want to cover are, please know about vulnerable populations. Okay, it's up here. Where's our vulnerable populations? Special vulnerable populations, right? So your pregnant adolescents. Who are your vulnerable populations? According to week 4, they're your pregnant adolescents, your LGBTQ, clients with mental illness, and clients maybe who are abusing alcohol or drugs. Okay. I want to go back to, or before I go to the LGBTQ, I want to review that with you. Cultural competency. Okay, I guess that would be in ethics. Okay, what's cultural competency? What's cultural competency?
Being aware of your patient's
Mhm.
cultural needs,
Mhm.
and understanding them and applying them to their care.
Correct. That's excellent. Cultural competency, the expectation is that you view everybody as an individual, right? You respect their values, you respect their beliefs, and the best you can, you try and incorporate those cultural preferences into their plan of care. Right? What are some barriers? Like if you are not able, what are some barriers you might face to providing culturally competent care? Maybe making assumptions could be a barrier. Assuming their diet, assuming their communication style, making those kind of assumptions. Okay, that's not culturally competent care. Believing your culture is more important than their culture. Maybe a lack of knowledge about their culture. What are some barriers that prevent you from developing cultural competence? Okay. And then there's another chapter that I want you to know. It's our, well, no, right here. Please read this. There's several questions on the school-age child and the adolescent. Okay, and it's more growth and development. If you're working with an adolescent that's 13 years old and they come to you with this complaint, why? Because they're in that developmental stage. Does that make sense? So I highlight chapter 19 and 20, not the whole chapter. Okay. So actually all of these to combine. 11, page 159, 41, 855, 856, it's already given to you. And then 19 and 20. Please review those. Okay, growth and development, or for the kids, for the adolescents, there's several questions about that. Okay. What do you do? Here's a scenario. What do you do? Or here's a scenario. Why they acting like that? Well, that's what teenagers do. Okay. And then the last thing I want to review is our, let's see. I want to go back to week 4. Okay, hang tight. Week 4. Guys, can you guys see my page?
Yes.
Right. This needs to be read. This is where your education and learning from LGBTQ comes from. Right here. All right. Okay. It's pretty extensive, but it needs to be covered. Okay. There are several questions on the exam regarding LGBTQ. I don't know if I'm supposed to tell you that, but yeah, why not? I mean, I want you to study this. So I want you to study this. Okay, what are some common concepts and terminology? Okay, what are the demographics? What are the health disparities with LGBTQ? And there are health disparities. Okay. And here's a good list of them right here. Figure 1. So if you're asked a question, I can't highlight here, which is kind of a bummer for me. So if you're asked about what kind of disparities might LGBT population face, there's your answer right there. How do you communicate with LGBT without being offensive? You got to get your own values and beliefs in check. Okay. Many other issues that impact LGBT community, aside from the health disparities, what are they? Social challenges, interpersonal. I don't think I can highlight this. I can't. Social issues, interpersonal issues. And then the kids, sexual and gender minority youth face challenges. No, you don't need to know this whole thing, but you need to be able to, like I don't need you to know all the statistics, okay? You don't need to worry about those. But just some important points about what challenges this population faces. How do you communicate with this population in a respectful, non-judgmental way? Okay. How do you help create an inclusive environment for this population? Okay. So how do you communicate that LGBT affirming clinical encounters? So this is how you communicate. Rather than making assumptions about the patients based on their sexual behavior, maybe ask open-ended questions, right? For example, are you married? Do you have a boyfriend, girlfriend? Instead of those questions, maybe say, do you have a partner? Are you in a relationship? What do you call your partner? You see where I'm going with that? Okay. Not all clinicians can become experts in LGBT. We know that. But they definitely need to have a baseline of learning so that they can address specific health concerns for this population. Okay. So have a read at that sheet. So I know I added information today, but that was purposeful. Okay. Yes, your study guide's not inclusive. And so as I was doing my preparation for this, I wanted to add some additional information that I thought was important for you to understand the concepts that we're covering. Right. And for anybody that came in,
Thank you.
hang on, I'm not done. For anybody that came in late, I need your name in the chat and your professor. And remember, these are what we're covering for this exam. Okay. Feedback for me. Has this been helpful? Do you feel a little bit more prepared?
I feel a lot better about this exam than I did the first one with the reviews.
Yes, I agree.
Hi, Diamond.
Hi. Quick
How are
question.
ya?
Did Miss good, how are you?
Good. So anybody that came in late, I really encourage you to watch the beginning of the review. Okay. I've covered a lot. I'm hoping I'm preparing you to take the exam, and you could rewatch the recording as soon as the recording's converted. I will send it to you. I'm going to try and do this quickly. I have to catch a flight early this afternoon. I want to go visit my grandbaby before I go take a flight. So I'm going to wait till this converts. I'm going to sit here and wait. And so I can make sure I get it out to you before I get going. How's that sound?
Perfect. And did Miss Crenshaw,
Thank
did
you.
she send the Kahoot
What?
to you? Did Miss Crenshaw send the Kahoot? She made a Kahoot and she said she was going to send it to you yesterday.
Oh, I actually emailed her this morning to get her recording. And if she has a Kahoot, well, if she has a Kahoot, we'll post it.
Okay.
All right. So I'll post her recording in all my sections as she will post my recording in all her sections. And if she has a Kahoot, we'll post that in all the sections.
Okay. Thank you.
Okay. I just was wondering, is this recording just to your class, or will it be available to me too?
Oh yeah, I'm going to send it to, we'll post this recording in all the PN sections.
Okay, I appreciate that.
Yeah, sure. So that's it for me. I'll stay. Does anybody have any questions, or I can stay on for questions? But I hope this was helpful.
Yes, thank you.
You're welcome and good luck. I have to open my exams too. I have to do that this morning. So maybe I'll do it when I get to where I'm going for you to be able to download it. So
You're gonna put it, oh, I can't talk. You're gonna put it in announcements, right? Well, the video, the recording, I'm sorry.
yeah. And I'm also going to tell you that your exams are ready to download. Some of you may have exams on Monday or Tuesday. So you need to download them over the weekend. So, well, thank you for everybody for attending. Make sure your names are in the chat and I'll let Dr. Kershaw know which of her students attended, and good luck on the exam.
Thank you very much.
Thank you.
You're welcome. Have a great weekend.
You too. Bye-bye.
Bye, Ellen.